Welcome back into Great Day, Washington. This segment is sponsored by the University of Maryland Capital Region Health. Having a primary care physician is crucial for your overall health. It's your go-to person instead of Dr. Google. So here to explain what a primary care physician can do for you is Dr. Tony Aluku-Anaforum, a family and sports medicine physician at University of Maryland Capital Region Health. Thank you so much for being here.
Thank you for having me today.
Of course. So what is the most important thing we should know about a primary care provider?
Absolutely. The most important thing that you should know about a primary care provider is that our goal is to really partner with you and your health when it comes to coming up with a personalized, customized plan to make sure that we keep you healthy throughout the lifespan. And I really like the fact that you mentioned, coming to us rather than going to Google. Like I tell people, Google didn't go to medical school.
Good
so
point.
It's really great to come to us so that we can help to make sure that we give you the information that you need about your health.
Yeah.
And I like to think about primary care physicians and other practitioners like being the quarterback of the team. We're the leaders of the healthcare team. We can help to really assess the situation, figure out if we need to have you referred to a specialist to take care of your care, or if it's something that we can manage on our own.
Yeah, going to Google can be a scary thing.
Yes,
don't do that.
absolutely.
Now, what is the difference between going to your primary care provider versus going to an urgent health clinic?
As your primary care provider, one of the benefits is that we have a full picture of your health. So we know about your medical conditions, medications, allergies, social history, family history, all of which can have an impact on the decisions we make about your health. In an urgent care, oftentimes you're going to see someone who may not have access to your medical records. They may not know the full history, and they're there really to address what we call a focused or problem-based concern. So someone who's maybe going in with a sore throat, a headache, coughing, and so they can make some decisions about your health based off of what you're telling them. But there may be certain nuances that they may not know about. It can be helpful to have an urgent care because there are times the primary care clinician may not be available, perhaps after clinic hours or on the weekends. But ultimately, long term, having that person who's in your corner consistently is really going to be key, even after you're seen in an urgent care.
Makes sense. You mentioned partnering with the physician, patients partnering. How do you help people take control of their health?
So my key and my approach to helping my patients take care of their health, I kind of think about it in three ways. So one, I educate them about how their mental health, physical health, emotional health, spiritual health all are interconnected and how it can impact their health outcomes. So for instance, if someone has high blood pressure, it's not just about pushing the medication, but asking them about the stress levels, how they're sleeping, their diet, because these can impact their blood pressure levels, but it can also impact their ability to adhere to treatment. I like to empower my patients. So I say, if there's something that doesn't work for you, please come and talk to me, because I don't want them to feel like I'm just making the decision for them without taking their needs into consideration.
You sound like a phenomenal physician. I want to come to you. Now, how often should someone go and see their primary care doctor?
How often a patient should go and see their primary care doctor is really going to be dependent on the ages and stages. So I think about it as, for instance, a newborn. We might see them every few days during their first weeks of life, then every few months, and then as they transition to adulthood, usually we'll see them on an annual basis. But for a patient who's pregnant, we start off seeing them usually every month, and then as they're further along in their pregnancy, every week. But if there's a chronic medical condition, such as high blood pressure, diabetes, we might see them every few months. Or even if there's like a mental health concern, sometimes I'll bring these patients back every couple of weeks just to make sure that they're doing okay.
Yeah. Now, once they have found their primary care provider, someone amazing like you, how easy is it to schedule an appointment?
So it can be very easy to schedule an appointment. We have a few different ways through the University of Maryland Capital Region. So they can call our number at 240-677-3000. They can also visit us at umcapitalregion.org/primary care to get additional information about the doctors that are available and the resources that we offer. And we usually are able to get them appointments within a couple of days.
Wow.
And our locations are, a few throughout the PG area. So we have Laurel, we have Largo, New Carrollton, National Harbor, as well as Suitland.
Wow.
So we have a lot of options for patients, and we look forward to having them.
Yeah, really makes it convenient for patients all over the
Absolutely.
area. Doctor, thank you so very much.
Thank you so much for having me.
Yes. You can go ahead and schedule an appointment with a primary care physician by calling 240-677-3000. Again, that's 240-677-3000, or go to umcapitalregion.org/primary care.